The World Health Organization is urging both the unvaccinated and vaccinated to keep wearing masks to prevent COVID outbreaks, but the CDC is standing by its guidance.
And say that the WHO really does have to make recommendations for an entire world where less than 15% of people are vaccinated.
So what should you do when masks are optional?
And I think everybody is struggling with these decisions.
Dr. James Cottrell is an infectious disease specialist at UT Southwestern. He points to an Associated Press review that found 99.2% of COVID deaths in May were unvaccinated people. So those with both shots are in the clear, but remember, unvaccinated kids aren't.
But if you're taking them unmasked into kind of some of these same areas, they certainly are going to be at risk of getting it.
There are big differences across Texas. 41% of the state is fully vaccinated, but in Southeast Fort Worth's 76105, it's just 25%.
The only barrier now is the mental battle.
Reverend Ralph Emerson's Rising Star Baptist Church is in the heart of the zip code. He's tried to endorse the vaccine while preaching, talking to people on the street, or at the barber shop.
You have to decide. You want to keep rolling the dice and hope, or do you at least want to get something that gives you some guarantee?
UT Southwestern predicts cases and hospitalizations will rise, especially around the time schools and sports start back, unless the pace of vaccination goes up or we start masking. The increase in deaths and suffering are preventable, but it'll require reaching those still holding out.
It really is just making the decision to go get the vaccine.
In Fort Worth, I'm William Joy.